On Saturday, ExplorationWorks opens up its new summer exhibit, Gear Up, the Science of Bikes. Since bikes first started making the rounds in the late 1800s, the popular machines have affected how people live, work, and play. Visitors to ExplorationWorks will get hands-on experiences and learn about the science and history behind bicycles. ExplorationWorks Executive Director Heather O'Neill says she's thankful for the community's continued support and looks forward to people experiencing the new exhibit.
I think the really neat thing behind it is taking a look at the science behind the bikes, how they function, how they work. Lots of people, know how to ride a bike, but to really understand everything that goes on behind the scenes to build that is pretty neat.
Gear Up, the Science of Bikes, opens Saturday, May 25th, beginning at 10 a.m. Registration is also currently open for their first ever community bike ride on Saturday, June 15th. Each participant will receive free admission to ExplorationWorks that day and a free ride at the Great Northern Carousel. We have more information on the new exhibit and the event on our website. This week is Emergency Services Appreciation Week, and rural EMS providers throughout Montana are using the week to bring awareness to the obstacles that they have. MTN's Owen Skornick-Hayes spoke with them on those challenges and why rural emergency services are especially important.
Well, it's EMS week around the country, and it's time to pay due recognition to some of our first responders. But what about those operating in rural counties? Well, I sat down with responders from Dutton and Fairfield, respectively.
If you live in a small community, your local EMTs, like Colleen Campbell and Leon Beachy, are probably already your good friends.
You know, Dutton only has 300 residents. The biggest probably crossover is just that we know most of our patients.
People are more comfortable seeing faces they know when they're having an emergency.
Campbell and Beachy both reside in Teton County, and though they rarely work together, they know each other well, facing the same challenges of being a rural paramedic. One chief concern are volunteer numbers.
Everybody seems to be busy nowadays, and there does seem to be a lack in maybe the community volunteer spirit anymore that used to be around.
According to the National Rural Health Association, 53% of rural EMS services are staffed by volunteers, people who pay for their own training to help save lives. Both Dutton and Fairfield rely entirely on volunteers. It's hard to entice folks to join because, unfortunately, their smaller scale doesn't justify a paid crew.
I don't know if it would help to have the ability to pay a crew or not.
There's not enough call volume to have a paid crew.
Worse still, Montana's paramedics are not afforded the same benefits and protections that fire and law enforcement are entitled to because of the state government.
Government-wise, we're not considered an essential service, so our funding is harder, all that kind of stuff.
The Montana House recently backed a bill to improve funding towards ambulance providers. Ambulance stations are closing around the state because Montana's lower than average rate for Medicaid reimbursements can't cover the cost of medical service.
The question I would like to ask any of our governing officials that are okay with it being a non-essential service is, if we need to respond to them, are they okay with it being non-essential and we don't show up, or to their mother or to their kid?
It's easy to get lost in the specifics and forget about why these responders do what they do.
Having the children know you and, oh, you responded to my dad, or, my crew or myself and another member, were able to deliver a baby many years ago for a young mother in our town.
A genuine love for people and community. From Teton County, Owen Skornick-Hayes, MTN News.